Good evening to everyone, and thank you for coming out, and it's great to be here. And I've got a short presentation on nutrition and colorectal cancer, focusing mainly on eating well during and after treatment. So let's get started. So a bit of an outline. What I'm hoping to do today is just talk a little bit about the benefits of eating well, looking at what types of foods you should be eating, some strategies to kind of help one maintain intake, diet and health guidelines, just general guidelines, and then to look at some frequently asked questions. So when we talk about good nutrition, the goal ideally is that we're eating a balanced diet that includes the necessary nutrients, so protein, carbohydrates, fats, vitamins and minerals, and of course phytonutrients. And most people I think now are familiar with what we call phytonutrients, which are just naturally occurring plant compounds that are found in foods. So things like your antioxidants would be considered phytonutrients. And those are naturally found in a lot of plant foods. And of course we need calories, and in preparation for treatment, but also just to help us maintain overall good health. Of course, one of the key things is that you always need to consider adaptations that have to be made to healthy eating guidelines, and that might be necessary before treatment because sometimes people actually have symptoms before they even have a diagnosis, and that might impact on their ability to eat well. But also during and after treatment, sometimes some of those issues are still a factor. So what are the goals when we think of someone progressing into having a treatment and through recovery? So one of the key things is obviously we want to provide optimal nutrition, despite the challenges that may exist. We want to try and help you maintain your nutritional health. And a huge part of it is to help to prevent or manage some of the eating-related difficulties that can arise during treatment. The benefits of eating well, I think you're probably all familiar with what those are. So ideally, we want to have you maintain your weight and preserve lean muscle mass as much as possible, maintain your strength and energy, protect your nutrient levels. So if you come in pretty good nutritional status, we're hoping to have you maintain that or improve it if we need to better tolerate the side effects from treatment. We know that if you go into treatment in pretty good shape, generally you're able to withstand the treatment better, to help support your immune system. Also, eating well promotes faster healing and recovery. So if you've had surgery, or again, in terms of recovering from treatment, good nutrition is important in that respect. And then along with other healthy lifestyle practices, good nutrition helps maintain and manage other chronic diseases. So you've had a diagnosis of colorectal cancer, but perhaps you're also a diabetic, or you've got osteoporosis, or you've got some heart health issues. So we have to look at the total picture. We can't just look at it in isolation. So in terms of what types of things ideally we recommend you be eating. So cancer and cancer treatment, as I said, can make eating more difficult, unfortunately. But we still try to focus on having you eat the best diet that you can. So nutritional requirements do increase during treatment, and in general we tend to focus especially on protein, so ensuring that you're getting enough protein. And quite often when we do assessments with patients, people are surprised that they're actually not eating as much protein as they thought they were eating. And protein is very important. Also, calories become important, particularly if you've had some weight loss. If you've not lost weight, then it's not as much of an issue. But if you've had weight loss, then making sure that you're perhaps having more calories would be important. Fluids, ensuring that you're getting enough fluids. And then, of course, other nutrients as well, like vitamins and minerals. So with respect to protein is important because it's really an essential component of helping you maintain a strong immune system. It's also responsible for growth and repair of body tissues, and particularly if you're on chemotherapy, where chemo affects all cells, not just the healthy cells. So for the other cells to be repaired and rejuvenated, you actually do need some extra protein. And protein also helps prevent muscle breakdown. So generally speaking, the recommendation is that if you're undergoing treatment, you should ideally be having between 1 to 1.5 grams of protein per kilogram of body weight. And like I said, quite often when we do assessments, we find that patients aren't necessarily meeting that requirement. Good protein choices, again, we're familiar with most of what those are. I've just listed a few there. So, meat, chicken, fish, dairy products for those who include dairy, nuts and seeds, nut butters, eggs, tofu. These are just some examples of good quality protein choices. Yes, you can get a little bit of protein from foods like quinoa, for example, but the amounts would be minimal. So it's important to look at some of these kinds of choices if you're really trying to maximize your protein intake. In terms of the calories, so it's important to be getting enough calories to maintain your weight. So particularly if you've lost weight, we want to focus on looking at ways to kind of try and help you regain some of that weight back. We do suggest checking your weight regularly. And in general, in terms of what's required, generally speaking, you need about 25 to 35 calories per kilogram of body weight. So for the person who is at their usual normal weight, they may only need about 25 calories per kilogram. But if you've had a significant weight loss, then you actually may need about 35 calories per kilogram, again, particularly going into treatment where we're trying to have you boost yourself. High-calorie foods, some examples would be things like whole milk and cheese and yogurt, sour cream, ice cream, yes, ice cream. And I'll talk a little bit more about that. Nuts, seeds, nut butters, avocado. These are just examples of some higher calorie foods that if you're particularly struggling to regain your weight or maintain your weight, you might want to focus on having these. Fluid intake, sometimes that's a challenge as well for individuals, and it's really important to be drinking enough fluids as you undergo the treatment. Sometimes patients will complain of being fatigued, and sometimes part of that fatigue is related to not getting enough fluids, so to being somewhat dehydrated. So fluids, it's important. It's important if you're undergoing chemotherapy as well to help flush the chemo through the system. So, and also if you're having difficulty with eating, then we actually do rely on fluids quite a bit to provide you with nutrition. So in essence, we want you to really drink your nutrients if you're really having a difficult time with eating. And in that case, you really want to choose less water. So quite often patients will focus on water and say, I should be drinking 8 to 10 cups of water a day. And that's great if you're not having any eating difficulties, if you're not needing to gain weight. But if you're needing to gain weight or you're not eating as well as you would normally, then it's really important that rather than drinking all that water, that a good portion of that would be fluids that would provide you with calories and protein as well. So these are just a few examples of, again, when we focus on fluids that provide protein and calories. So soups that are made with legumes or fish or meat would be good choices. Milk and milk products, soy beverage. Beverages like almond beverage, coconut milk, etc. are not good sources of protein. So that's why they're not included on this list. But soy milk is a good source of protein, so that's a great option. Smoothies, and to smoothies you can certainly add things like a protein powder, a whey protein powder, or a vegetarian type of protein powder. So there's some options there. And then for those who like the liquid nutritional supplements, they're certainly readily available as well. So if you're not eating well, then we want you to focus more on the fluids that provide protein and calories. If the next category would be those that at least provide you with some calories, even though they don't have protein. So there are a few examples listed there. And then the ones that provide you with neither calories or protein, we certainly want you to minimize those if you're not eating well or if you've had weight loss and trying to regain some weight. So in terms of other nutrients, so vitamins and minerals, so we want to focus really on getting vitamins and minerals from a variety of foods. And I know sometimes that can be a challenge for individuals with colorectal cancer, just having had surgery, or maybe you've got an ostomy, and those are challenges that we can work with patients to try and sort through. But ideally, we want you to rely on foods for your vitamins and minerals. If you're not eating well, then generally through treatment, check with your physician. Most physicians are okay with you having like just a basic multivitamin, so something that has a little bit of all of the different vitamins and minerals, and certainly vitamin D would be okay as well. But we really do discourage supplementing with large doses of the antioxidant vitamins. So vitamin C, vitamin A, selenium, zinc, etc. Those are not recommended for use during treatment. And Mark will probably speak a little bit to that topic, further to that. So in terms of trying to maintain your intake, these are just some general tips. So before treatment starts, try to stock your pantry and freezer with some of the favorite foods, things that you know generally enjoy eating, even if you're not feeling so well. It certainly is okay to use your freezer. Like sometimes individuals aren't sure whether they can actually, whether it's okay to have frozen vegetables, for example. So we encourage you to do that. Stock your freezer with some of those options. If you buy fresh vegetables and you have them sitting in your fridge and you don't use them for weeks, then you're losing nutrients over time anyway. Whereas fruits and vegetables, for example, are frozen at their peak. So they retain all their nutrients, and if you're essentially just using them in a smoothie, or in the case of vegetables, we'll suggest putting them in a soup or just steaming them, not boiling them, and then throwing away the water because you lose some nutrients that way. But if you just steam them, or if you're adding them to soups, etc., then you're going to retain the nutrients that way. Do some cooking in advance if you can, and freeze in smaller portions so that it's easy when you're going through treatment if you're having some challenges. And this is a great time to ask family and friends to help with shopping and also with meal preparation. And also consider prepared foods. There are some meal services where the meals are actually quite of a good nutritional quality and quite tasty, so look at that as an option as well. Other strategies to help maintain intake, so trying smaller meals is always helpful. Sometimes just having a really large meal, just looking at a really large meal, if your appetite's not that great, sometimes that in itself is a turn off. So just to see all that food on a plate, you're just not interested in trying to have anything at all. So smaller meals is always a good strategy. Snack as needed, and do eat frequently. Even if generally you're a 3-meal-a-day type of person, if you're having some challenges eating during treatment, we really do encourage trying to eat more frequently. Sometimes that's a preferred way of eating. For example, maybe if you've, got some GI issues, sometimes if you have a large meal that can trigger diarrhea or bloating, etc. So smaller meals more frequently is recommended for many reasons. Have protein at each meal and snack. So again, we generally tend to think of having a protein with supper and sometimes with lunch, not always with breakfast, but do try to have a protein with each meal, and also a bit of protein with your snack. So maybe your snack could be something like a Greek yogurt, which is higher in protein, or some cheese and crackers, or hummus with vegetables, etc. So try to have a little bit of protein with your snack as well. As I mentioned before, pay attention to fluids, and in particular, if you're needing to gain some weight, look at ensuring that you're getting fluids that will provide you with some additional nutrition. High-calorie, high-protein beverages are available commercially, or as I mentioned, many people do enjoy making their own smoothies, and you can put all sorts of great combinations of products in that. Managing treatment side effects. Now there's some great resources available. Speak to your healthcare team. These are just some examples of some of the brochures that we have available over in the Odette. So there's definitely help. If you're having difficulty, speak to the team. They can refer you certainly to ourselves as dietitians or nurses, etc., can provide you with some assistance in this regard as well. So what are the general tips for healthy eating? And ideally, prior to treatment, we're encouraging you to eat healthily. And once the treatments are all finished and you're moving beyond your treatments, then again, the idea is that you would resume your healthy eating practices. So what we encourage is to, first and foremost, try to have a variety of foods. And that's even within some of the constraints that you may have. So for instance, maybe you have an ostomy and you're finding that certain vegetables just aren't working so well for you. Try to focus on the range of the other vegetables that you're able to have. Again, include protein at meals, drinking lots of fluids. Eating more of a plant-based diet is what's recommended. Eat more vegetables and fruits. Choose healthy fats and oils. Make whole grains your preferred carbohydrates and try to limit high-calorie, high-fat snacks. And we encourage limiting processed foods and salty foods. And this little diagram just shows when we look at the plate, ideally what we're encouraging is that you kind of have half your plate as vegetables and then a small portion of your starchy vegetables or things like potato, rice, etc. And then a quarter would be your protein foods. And then with a little bit of some type of dairy or other calcium-rich food and fruit as well. Don't forget as well, we would encourage that you try to also, assume other lifestyle habits that are good. So limiting alcohol. Generally, the recommendation for men is no more than 2 drinks a day. For women, no more than 1. Try to, again, maintain a healthy body weight. Moving forward, we know that maintaining a healthy body weight is important. And of course, try to engage in regular physical activity. And now with respect to physical activity, even during the treatment, patients are encouraged to maintain their physical activity levels. And there are actually now some cancer exercise guidelines that are available for patients. And you can speak to your healthcare team about that as well. So just quickly, what some of the frequently asked questions that we get as dietitians. So one of them is just this whole idea of where there's so much emphasis on plant-based diets and eating lots of fruits and vegetables. And it sometimes really is a challenge for many of our patients who have colorectal cancer. Again, perhaps with surgery or an ostomy or just the side effects from treatment, it is challenging. So these are some of the suggestions that we make. Peel your fruits and vegetables to decrease the fiber content, because sometimes a little bit less fiber makes it a little bit easier, less easier to tolerate fruits and vegetables. Cook vegetables and fruit. Try to use unsweetened canned or jar fruit to sort of help you augment your intake. Fruit and vegetable smoothies. Don't forget vegetable juices or blended, vegetable soup. So these are just some ideas to sort of help you include more fruits and vegetables. Red meat is always a big one with colorectal cancer. And so again, our general guideline, I'll just skip this. Essentially, what the studies have found is that diets high in red meat, so more than 18 ounces a week, are linked with increased risk of colorectal cancer. So the recommendations we suggest patients follow is the recommendation from the American Institute for Cancer Research. And what they suggest is that we limit cooked lean red meat to no more than 18 ounces per week. So that's like your deck of cards. And that would be 6 of those if you choose to have red meats. You don't have to, but if you choose to, these are the guidelines, and that we avoid processed meat. And red meat is beef, pork. Some people see pork as a white meat, but it's considered red meat. Lamb, goat, veal, etc. And then processed meats, well, we all know what those are. One reason why we sometimes say if you don't object to excluding red meat entirely, one benefit of having a little bit of red meat through treatment is that one of the side effects from treatment can be to drop red blood counts. And the nutrients that are important to help keep the blood healthy are protein, iron, folate, and B12. And here are some examples of foods that contain them. And you can see that meat, fish, poultry, eggs, etc. are included. They're a good source of protein, also a good source of iron, along with other foods, of course. Folate, and also in particular vitamin B12 is a little bit challenging to get enough if you're not including red meats in the diet. You have to look at other ways to make sure that you're getting B12. So if, as I say, you're not adverse to having it, then it's certainly okay to have it, but we do suggest keeping it to smaller amounts. Should I avoid dairy is another key question that we get. And again, our suggestion is that if you we don't suggest that you exclude dairy from the diet, but if you choose to, there's certainly alternatives. I think from our perspective, the more important thing is that you do get enough calcium and vitamin D. So this just highlights what the requirements are. You can certainly get the calcium and vitamin D from dairy if you choose to include dairy. These are some examples of choices, but there's certainly many non-dairy choices that are available as well. So again, the important thing is that you do get enough calcium and vitamin D, and you can get it either from dairy or non-dairy choices. Another popular question is, again, the whole idea of sugar and cancer. And I guess I'll skip to the bottom line, is what we're suggesting is that you do try to decrease your added sugars. So a lot of table sugar, corn syrups, honey, maple syrup, agave, even the healthy sugars in moderate amounts. So we're not suggesting you exclude them, but we do suggest maybe having lesser amounts of those and focusing more on whole foods like fruit or 100% fruit juice if you do include fruit juice. Yogurt that might have a little bit of added sugar in it because they've got other nutrients in them as well. You can get protein, you get your vitamins and minerals, etc. In terms of added sugar, the American Heart Association, they've come out with a recommendation that we say you can use as a guideline. And what they're suggesting is that for women, we try and limit our added sugars to about 6 teaspoons per day, and for men, 9. So again, that's just a guideline. The important thing I would say is that when you're undergoing treatment, the key is to get you through the treatments. And if that means that perhaps what works at this point in time is that you might be having maybe pancake with maple syrup or ice cream or things that naturally contain some added sugars in them, that's not a problem. In moderation, it's not an issue. I think the concern is when the diet is one that consists of a lot of high-fat, high-sugar foods. But if you're eating healthily and including small amounts of these foods, that really is not an issue. Again, if you're including some sugars, one of the ways in which you can sort of have lessen the effect of the increase in blood sugar levels is to pair sugars with protein. So again, if you're having maybe fruit, you can have that with some nuts or a piece of cheese or cottage cheese and fruit, etc. So that helps. And do choose, it's important to choose carbohydrates because sometimes we find patients are really trying to limit their carbs. But remember, in choosing the carbohydrates, what we're encouraging you to do are to choose the carbs that come from our vegetables and fruits and whole grains and legumes, not to be excluding those. If you need help, like I said, the dietitians can be accessed through the Patient and Family Support Program at here at the OCC. If you're not a Sunnybrook patient, then wherever you're going, there usually are dietitian services available. We're available to help answer questions and concerns, and more importantly, our goal is really to work with you to help manage any eating challenges that you might have. Thank you.